Hi everybody, my name is Ken Link. I am the Alumni Director here at Foundations Wellness Center, and I am here with KJ for her staff spotlight. I'm going to ask her a few questions. So KJ, what is your role at Foundations?
Well, my role here at Foundations is I'm the Group Facilitator. I'm also the case manager. If you're not aware of what a case manager does, I take care of any of the FMLA, short-term disability. I also send letters to the court system, letting them know that you are present in treatment in case you have a court date coming up or what have you. I'm pretty much the versatile one here. I do whatever is necessary. If there's a client need, if a client needs 5 minutes timeout time because they're having a rough day, they come hang out with me. I'm kind of the resident ass kicker here. I'm also the mom, the big sister, the whatever it is that needs to get done in order to ensure that the clients stay with us. It's pretty much as comfortable as possible. That's always something that I believe in, is getting someone just settled in so we can get down to business, because that's why they're here. That's why they're with us. So the sooner we can get them acclimated, the better. So that's part of what I do here.
Awesome. And what is your favorite part of that job?
All of it, actually.
I knew you were going to say that.
My favorite part really is the interactions I have with the clients, because of the fact that the versatile ages that we get in here, from the younger kids, most of them are around the same age as my own children. So, but then also having the older population of people that come in, and it makes it a little bit more versatile as far as, how they can identify and how they can help one another, rather than just us doing all the work. We kind of depend a lot on our community. So I'm very, very active when it comes to the day-to-day operations of a client's life. I'm constantly checking in. I'm constantly watching to see, where they're at. I have a really good, keen sense of whether they're having a rough day. I mean, they don't realize, the one thing that a lot of people don't realize is we wear a lot of our emotions on our sleeve or on our face. It's our nonverbal communication, that pretty much gives us away all the time. And so they, you ask them good morning, making sure that when you're reading that and they're giving you that same old excuse of, oh, I'm fine, I'm good. It's like, yeah, no, you're not. So it kind of gives them the opportunity to be a little bit more open, honest. I mean, my office is the size of a closet, as you know, so it's a very intimate setting. So there is a way out, though, but
No, and I like that you said that, the wearing the emotions on your sleeve, because many times, even when I'm walking through the building, you pull me aside. So that is true. Why did you choose Foundations Wellness Center to work at?
I've been in this industry for 16 years, working at various different, locations. The place that I was at prior to Foundations was definitely quantity over quality. And I'm dealing with 107 clients at a time. So that you can tell the quality of care is definitely, that was not the high priority. Although with the staff that I did work with, we were able, to do the best that we could with what we had. I've also worked in a more intimate setting like Foundations is now. But a lot of the people that I've worked with in the industry came over to Foundations. And I have a history, with some of the ownership here that I highly respect, and I thought, what, I want to do good work. That's really my main goal, is I really want to do the best work I can to help as many people as we can. And Foundations was brand new when I got here 2 years ago. And that's the main part of why I love, it's a family, we're a family. I tell the clients all the time, welcome to your second dysfunctional family. So, and that's what we do as staff, we all look out for one another. So that's my favorite part about working in Foundations.
Now, if you could say anything to a person that's thinking about coming to Foundations, what would you tell them?
The first thing I would tell them is get all the ideas out of your mind that we are the run of the mill, because we're not. You're not going to be a number. You're not going to be a policy. You're not going to be able to skate through.
You can't hide from us.
No, absolutely not. And so, and that's what I was saying. What I was saying, talking about previously was the fact of if you really want help, we really will help you, whether you want us to or not. We really will. And there's no lines between the therapeutic staff, the operations staff, the alumni staff. We pull every stop out that we can in order to help a client. If I can't help them today, I will pull Ken, I will pull business development, I will pull our executive director. We do whatever we have to do. And so that's the one thing that, if you're wanting to come here, you don't need to worry about anything, but definitely you will not be the guy that's going to skate, because that doesn't happen here.
And my favorite part, please give us a fun fact about KJ.
Oh my gosh. First of all, I'm a diehard hockey fan. Everyone makes fun of the fact that I say a boat, but it's because I watch a lot of Canadian hockey, which hockey season started. But anyway, I have 16 years sober, and I have a clouder of cats, which means I'm not telling you how many, but I have a clouder, meaning more than 1, 2, 5, 10. I just love the fact that the life that I have now. I'm a mother of an addict, and I'm a grandmother of, I think, 11 now, step grandmother, but still. So I have a very, very full life. But my fun fact is that I am a diehard hockey fan. That's my thing. So
awesome. So you guys got a chance to meet KJ. Please tune in for the next one that we have next coming week. But let's thank KJ again, and thank you guys for tuning in.